What's up guys, Dr. Katie here, back with another video for you all, and this is Hey Doc. On this channel, we create important medical content to help you stay in good health and support you in making the right decision when it comes to your health. So if this type of content tickles your fancy, as I've always said, be sure to subscribe, like, share, and don't forget the notification bell. Let's get straight into today's video. Now, here's some facts for you. Did you know that according to the British Heart Foundation, there are around 100,000 hospital admissions due to heart attacks alone in the United Kingdom? This means that there is a heart attack happening every 3 minutes in the United Kingdom. Sadly though, 7,400 will die each month as a result of having a heart attack. And in the US, according to CDC, someone has a heart attack every 40 seconds. Every year, 805,000 people in the United States will have a heart attack. Of these, 605,000 will have experienced their very first heart attack. So, with the statistics in mind, we now all know that heart disease is a very important health topic. In this video, I will be going through with you early heart attack signs you should never ignore. So, first things first, what is a heart attack? During a heart attack, also known as a myocardial infarction, there is a blockage in one or more of the coronary arteries. The coronary arteries are the vessels that supply oxygenated blood to the heart muscle itself. This blockage can be caused by the buildup of fatty deposits, also known as plaque, along the artery, which can then rupture and form a blood clot in the artery that then blocks the flow of blood in that vessel. Therefore, that blood vessel cannot supply oxygenated blood to that section of the heart muscle. Now that we are aware of the very basic of what a heart attack is, here are some important symptoms that you should never take for granted, and you should always consult your own doctor about whether you need to be further investigated for a heart attack. One of the most common symptoms of a heart attack is chest pain or chest discomfort. Patients have described it as pressure, as though someone is sitting on their chest tightness, someone squeezing the chest wall, or sometimes described or experienced as a burning sensation in the chest. Now, this is very important for patients who suffer from acid reflux disease. It's important not to misinterpret your acid reflux symptoms, which can often be feeling as though acid is coming back through your chest. Now, for patients who normally suffer from acid reflux, please do not take a symptom or an episode of acid reflux that is not responding to your normal treatment. So if you are on tablets or on alginates, and that would be a drug to help settle the acid, either in the form of a tablet or a liquid. If you take these that would normally settle your acid reflux symptoms and you realize that it's not actually doing what it's supposed to do or what you're used to experiencing, and that would be that the symptoms would come down and this sensation of burning in your chest continues to persist, please remember that this is or can be a heart attack that you are actually having. So do not take those symptoms for granted and seek the attention of your own doctor, and do mention the fact that you have tried all the medications that you're used to taking, but it's not settling. And sometimes prompt your doctor to say, could this be a symptom of a heart attack? Could this be an early symptom of a heart attack? And that should prompt your doctor to do the needful, to do the investigation, and not to dismiss the symptoms that you're experiencing as your usual day-to-day acid reflux. acid reflux disease. Now, we've all seen the health promotion adverts that talks about, what to look for if you have a heart attack. And there is a classical chest pain, chest discomfort, which I've just discussed, and I've gone through some of the things that you could feel if you're looking out for early signs of a heart attack as it relates to chest discomfort. And we also have heard of the radiation of the pain in the left arm, in the neck, and in the jaw. But it's important to realize that not everyone will experience radiating symptoms. So I've seen many patients when I ask them, I probe them about their presentation with chest pain, and they would say to me, "Oh no, doctor, this can't be a heart attack because it doesn't go to my neck or it doesn't go to my left arm. It's not a heart attack, it's just chest discomfort." And I always have to explain to them that because you're not having radiating symptoms does not necessarily rule out a heart attack. That being said, radiating symptoms are a very important sign. If you're experiencing chest discomfort, chest pain, together with radiation of the pain in your left arm and in your left, and on the left side of your neck, in your jaw, it may well be a heart attack. Some people only experience radiation of the dull ache in the neck, in the jaw, even in the gums at times, and in the left arm. Some that are experiencing a heart attack only will experience pain in their gums, so not just one side of the gum, but the whole line, the upper and the lower gum area, or even just the lower gum area, jaw pain, neck pain, and pain in their left arm, or one of these, but it's consistent and dull and is not settling with simple analgesia, paracetamol or aspirin, are not taking that just very dull ache away. If you are experiencing pain in the jawline, just make sure that it's not a toothache. So basically when you're biting down, if it's not aggravating the pain or you don't feel pain in a particular tooth, just be wary and be on the alert of an early sign of a heart attack. Now, at this point, it's important to mention that some people will not experience chest pain, as I've mentioned previously. And so the people who don't experience chest pain, these people will often present with shortness of breath or just dull ache in the jaw. It's not textbook, barn door, bread and butter presentation of a heart attack. These people present with a silent heart attack, and this is more common in diabetics and in the elderly. Here on Hey Doc, we are a health community. We promote good health and we share evidence-based, reliable medical information. And here on the community, we realize the importance that sharing our health experience will be to another person, and some ways that you may have experienced a heart attack, someone else may not be aware of that. And so by sharing some of your experiences down on the comment section, you might actually be helping another person prevent or be more alert to some of the symptoms that they are actually experiencing right now that could trigger them to seeing their doctor, and ultimately you may save somebody else's life. So here is a question for you. Did you or someone you know ever developed any symptoms of a heart attack that were ultimately ignored? And if they are still with us, they made it alive, what are some of the complications that they are experiencing? Or if it's you, what are some of the complications that you are currently going through as a result of ignoring those early heart attack signs? We'd love to hear from you. Again, all in the purpose of supporting, highlighting these early symptoms that could help another person. Thank you as you share your experience in the comment section. Let's go on with this video. Shortness of breath. Shortness of breath is another very common sign of a heart attack. Most importantly, if the shortness of breath is of a sudden onset. One day you are fine, you're not short of breath, you were able to carry out your day-to-day activity without running out of breath. And then another day, you all of a sudden feel that it's difficult to breathe. You actually have to take your breath very intentionally. You really have to think about every breath that you take. You must think that this may be an early sign of a heart attack. Now, let's consider the science behind the reason why someone who is having a heart attack will feel short of breath. During a heart attack, the blood vessel supplying a particular part of the heart, that's if one blood vessel is blocked, or if multiple blood vessels are blocked at the same time, those different parts of the heart supplied by those vessels that provide oxygenated blood to those parts of the heart are essentially being damaged because they are not receiving adequate amount of oxygenated blood. So, as these parts, or one part or multiple parts of the heart muscle become damaged, they die, and therefore the heart is no longer able to pump effectively to supply blood to other parts of the body that need this oxygenated blood. Therefore, we start to feel short of breath. For example, the part of our bodies that need the oxygenated blood is our lung. And if our lung is not receiving enough oxygenated blood because the heart muscle is not pumping adequately, we will eventually feel short of breath once a heart attack has happened. So, for people who do not have a chronic history of feeling short of breath because of a long-standing lung disease or long-standing heart disease, if you are feeling short of breath all of a sudden, please remember that you need to consult your doctor and bring it up with your doctor that could this be a sign of me having a heart attack, particularly if you're elderly or diabetic. Because remember, we mentioned that these two groups of people are more likely to have a silent heart attack. That means they do not experience the classical chest pain or chest discomfort or radiation symptoms that were previously mentioned. Another early sign of a heart attack is out of the norm sweating. Are you sweating all of a sudden? Are you having cold sweats just randomly? Especially when the weather doesn't correspond with how much it is that you are sweating. Think of an early sign of a heart attack, most especially if you are having other symptoms such as shortness of breath and chest discomfort, or in the case of some people, heartburn. The reason why people sweat when they're having a heart attack is because of the body's natural response to stress and pain. When the heart muscle is damaged, the body responds by releasing stress hormones like adrenaline and noradrenaline. And this, my friend, is a reason why sweating is a common symptom in people who are having a heart attack. Let me remind us all that no symptom is too minor. Every symptom, no matter how small, as long as it is out of the norm for you, should be taken seriously. It could save your life. Now, many patients I've spoken to who have experienced a heart attack have also testified to the fact that whilst they were having the mild chest discomfort that often is taken for granted and is ignored for several days, they also noted that they had a feeling of feeling nauseous, the desire to vomit. Some even vomited. That's after several days of ignoring the chest pain or the jaw pain. They ended up vomiting. For some, whilst the heart attack is at its peak and the pain is at its worst, they will actually vomit. Yes, I know, it sounds very random, feeling nauseous and vomiting whilst you're having a heart attack, especially if you've not experienced a heart attack yourself. It feels very out of the norm. It's a gastrointestinal symptom that is presenting in a cardiac pathology. But the reason why that happens, the reason why people who are having a heart attack may feel nauseous and some vomit, and that's because the heart and the digestive system Both share the same nerve. And during a heart attack, the nerve that supplies the heart becomes irritated, and the brain can interpret this irritation to be coming from the stomach. Hence why you start feeling nauseous and may eventually vomit. Are you enjoying this content so far? Do remember to subscribe, like, share, and don't forget the notification bell. These will all contribute in getting more people into this community where we will all be helping one another to stay in good health. Now, as the heart muscle becomes damaged and the heart is less able to pump blood effectively around our bodies, one of the very important organs that is affected is our brain. Because the heart is not pumping blood around our body effectively, our brain is less able to get enough oxygenated blood, and so naturally we start feeling lightheaded and dizzy. Therefore, lightheadedness should never be taken for granted, particularly if it's consistent and happening even at rest. During a heart attack, feeling palpitations or this sensation that your heart is beating rapidly, or that it may even feel like your heart is skipping beats or beating irregularly. This is very common because as the heart muscle is not able to receive enough oxygenated blood, there is a release of stress hormone, which in turn cause the heart to beat much faster. Experiencing palpitation during a heart attack can be a sign that you are actually having a more serious type of heart attack known as myocardial infarction. This is when a large surface area of the heart muscle has actually started to die. So, although palpitations can be caused by other things and other heart cardiac pathologies can cause you to start feeling your heart beating a lot more rapidly, it's important to remember that palpitations can be a sign of a heart attack, particularly when it is experienced much later on. Now that we've discussed some of the important symptoms never to ignore, it is important to highlight the fact that not everyone will experience all of these symptoms at the same time. Also, that the symptoms may vary from person to person. You may get one or several of those symptoms, or in the case of some people, they may actually be experiencing a silent heart attack. So it's important to be aware of these signs, but not to wait to get several of them before you seek medical advice. Or not to expect that your presentation will be textbook, will be exactly how I have described it here. And that is why our community here on Hey Doc is ever so important, because you get to read and get to share real life experiences of people who have had heart attacks. So let's learn from one another. Symptoms may not always be sudden or severe. They may be very subtle. The most important thing is, if you are unsure, call the emergency services. Go through your symptoms with them, and they may be able to direct you towards you seeing your general practitioner or family doctor, or may say to you, no, you need to be seen right now in the emergency department. Never shy away from seeking help. When it comes to your heart, no question is a silly question. No symptom is a minor symptom. Remember, time is heart muscle. If you think you may be having a heart attack, do the following immediately. Call the emergency service for the country in which you reside. For example, in the UK, 999. Australia, 000, and of course in America, 911. Stop all activities that you are doing immediately and sit down. As long as there are no contraindication, and for you and your health, there are no reasons why you cannot take this drug. For example, you're not bleeding from the gastrointestinal tract, you're not allergic, or for any other reasons why you may not be able to take this drug. If it is appropriate for you, take 300 milligrams of aspirin immediately. You may chew that tablet, or dissolve it in water and drink it immediately. So I hear you say, I don't have aspirin 300 milligrams in my house. This could be something that you can consider addressing. Could you need to keep aspirin 300 milligram in your home? Are you at risk of developing a heart attack? Do you have a lifestyle that puts you at risk of developing a heart attack? Is there a significant family history of a heart attack for you? Have you had a heart attack scare in the past? If that is you, I would recommend that you keep an aspirin 300 milligram in your home. Once again, it is very important to check with your doctor if there are any reasons for which, for you cannot take aspirin 300 milligram. But if you have been given the all clear from your doctor, it is an important drug to keep in your home, especially if you are at risk of developing a heart attack. Most importantly, do not panic. Once you've called the emergency service, ensure that you reach out to friends and family if they are not already around you to let them know what is happening to you. And that way you can get enough support. And other things that you need to take care of can be taken care of, such as children and other priorities that you have can be taken care of, so that you don't have to worry about doing those things and put your health secondary to some of your other responsibilities. So that's it, guys. I trust that this video has been helpful and has been informative. As always, we encourage you to subscribe, like, share, and comment, and click the notification bell. I look forward to seeing you in our next video. Take care, guys.